What's up, guy? In this lecture, we are going to discuss the different skin manifestations that represents patient is having hypothyroidism. So, before discussing these manifestations, we have to know what is hypothyroidism. In hypothyroidism, you will see the reduction in the thyroid hormones like T3 and T4, and as a result, your body metabolism start reducing, and you will see the different skin manifestations in hypothyroidism patient. So first thing that you see in skin is xerosis. In that condition, you will see sweat and sebaceous gland activity start reducing. Sweat gland involves in the production of the sweat, and sebaceous gland involves in the productions of the sebum or oil. If these activities reduced, then as a result, the sweating and the oil production will also be reduced, and skin is going towards dryness. And epidermal turnover, like shedding of the epidermal cells over the skin, start also be reducing. So in that case, overall you will see the dry, rough and scaly skin in hypothyroidism patient. So this is the condition you will see in hypothyroidism, that is dry skin. Second is the hypohidrosis. Hypo means low. In that case, that will be the similar one, reduce in the activity of the sweat gland, and as a result you will see reduced in sweating, or in some time there will be the no sweating in that case. Again, in that case, the patient faces the dry palm and the soles. So palm and the sole start drying, and overall skin will going towards the dryness. So this is the second skin manifestations. Third is the pallor. So in hypothyroidism, metabolism is reducing. So in that case, skin blood flow will also be reduced. And whenever the blood flow towards the skin start reducing, in that case, you will see the pale skin. So that is another important skin manifestation. Next is the carotenemia, high level of the carotene. In normal situation, inside your body, carotene converts into the vitamin A. When there is reduction in the T3 and T4, like in hypothyroidism, you will see this conversion start reducing, and as a result, carotene starts accumulating in your skin, and as a result, your skin color start changing, and it will become yellowish skin, and specifically on the palms and on the soles, yellowish skin. But another important thing which you have to remember, in jaundice you will also see the yellowish of the skin. But how will you differentiate jaundice with the carotenemia? So a most important thing in the clinical manifestation is the sclera. You will check the sclera eye. If the eye color is normal, then it will be the carotenemia. But if the eye color start changing, specifically sclera of your eye, then it will go towards the jaundice. And the lab result will confirm these manifestations. So this is the carotenemia in the hypothyroidism. Myxedema, in that case, what will happen? Metabolic activity start reducing, and different substances, mucopolysaccharides, start accumulating in the tissue of the patient. What will be the mucopolysaccharide? Like the hyaluronic acid and chondroitin sulfate. These two mucopolysaccharides will start accumulating inside the tissue, and as a result, the accumulation of these mucopolysaccharides will enhance the retention of the water inside the body of the patient, and as a result you will see the edema. So that will be the edema caused by in hypothyroidism patient. But what type of edema? Non-pitted edema. So in normal situation, in normal ordinary edema, you will see it can be pitted edema. When the finger is pressed on the skin, it will insert in the skin. But in non-pitted edema, when you press the finger on the skin, then skin will not go inside. So that will be the non-pitted edema in hypothyroidism. So in that case, patient face will start puffy face. You will see of the patient, swollen eyelid and facial fulliness will be seen in the hypothyroidism. So these manifestations are due to the accumulations of the water in the tissues. Next is the periorbital edema, like swelling around the eye. In that case, you will see the puffy eyelids, and as a result, when the eyelids start swelling, then you will see the narrowing of the palpebral fissure. Palpebral fissure, what is palpebral fissures? Like the opening area of your eye. If I say, here is the upper eyelid, here is the lower eyelid. At the lateral side, you will see the lateral canthus, like the corner of your eye. And here is the medial canthus, like the medial part of your eye or the sclera. So how much opening you will see in that case? Normal, so this is the normal eye, but in the periorbital edema, you will see the, here is the opening of the eye, like palpebral fissure. So this is the normal opening, palpebral. Here is the palpebral fissure start reducing. So narrowing of the palpebral fissure you will see in the hypothyroidism. So this is another most important manifestation in the hypothyroidism, like periorbital edema, swelling around the eye. Skin thickening will also be seen, as we have already seen, deposition of the mucopolysaccharide in the tissues, and it will start retentioning the water in the body, and as a result you will see this skin start thick. So thick and coarse skin you will see in the hypothyroidism. So thickening of the skin will also be the most important manifestation in the hypothyroidism. Cool skin, like T3, T4 start reducing, basal metabolism start reducing, heat reduction in the heat production, and reduce peripheral blood circulation will also be seen, and as a result the patient skin will be cool as compared to the normal one. So these are the different manifestations you will see in the hypothyroidism. If you still have any question regarding any one of it, you may ask in the comment section. Thank you so much.